Hello, my name is Allan, and I am a military medical doctor based at the University of Leeds in the United Kingdom. It gives me great pleasure to present some of my initial work titled No News is Good News, where we have provided a machine learning alternative to the National Early Warning Score. I want to first start off with the underlying motivation of this work. I specialise in anaesthesia and intensive care medicine, which means I provide advanced interventions to the sickest patients in the hospital. Hospitals such as St James's Hospital in Leeds, which has upwards of 1,100 inpatient beds and multiple critical care units. For me to be able to provide these interventions, I need to identify those who are at most need of the interventions. And that is identifying those who are the sickest and those who are at risk of impending death. It'd be tempting to use all the investigations that we have under the sun for every patient, but that would take time and needs to be done at scale. And so we need to be able to use the information that is readily available at the bedside. The current system that we have is the National Early Warning Score. This uses physiological information such as heart rate, blood pressure, respirate, and oxygen levels, and allocates each a score based on the derangement and aggregates them. Should this total score exceed a threshold, I'm called to see the patient to review them. Similar systems operate in the United States. We have studied eCart as another system. The problem with these type of systems is that they don't model trajectory, as they only look at each time point independently, and they disregard any relational information between variables, both of which are important in the assessment of the sick patients. Our solution to this is to use a multi-channel LSTM network, which takes raw information at each time step and tries to learn the relational information and the temporal information to determine whether this patient will die in the next 24 hours. Initial work on Mimic 4 suggests that we have improved recall and positive predictive value, which means that we are able to detect more cases of impending death without increasing the false alarm rate. We hopefully demonstrated that current EWS systems don't fully utilize readily available information, and that there is a viable alternative to the News 2 system that is able to utilize this temporal information. Thank you very much for listening. Feel free to connect with me through the QR codes, and I look forward to talking to all of you at the poster presentations.